Hello and welcome. You are watching Gravitas Plus. I am Molly Gambhir. Imagine being in a situation where you or someone you love desperately needs healthcare, but you're not able to get it. Whether it's because you're not able to access it or you can't afford it. Either way, that situation is a nightmare nobody wants to live through. But what happens when these worst fears turn into reality? And what if they did not have to go through this in the first place? Let's take the example of the situation in India. There is a contrast at play in a way, which is hard to miss. Large corporate hospital chains that benefit from government incentives. Revenue is earned from foreign patients and affluent Indians, for example, as well. But what if that could be used to help fund treatment for poorer patients and help bridge this gap? Let's tell you what a parliamentary panel has recommended. According to the report of the department-related Parliamentary Standing Committee on Health and Family Welfare, on the subject affordability and accessibility of healthcare facilities in public and private sector, medical tourism has significantly boosted the revenues of large private hospital chains, but the benefits have not adequately reached economically weaker patients. Basically, the Parliamentary Standing Committee has made recommendations arguing that the country's private healthcare boom must also improve access for those unable to afford advanced care. Let's just tell you more about what the report says. According to it, large corporate hospital chains that benefit from government incentives, including 100% foreign direct investment or FDI, should use a part of the revenue they earn from international and wealthy patients to subsidize treatment for poor Indians. And you know what the difference between the cost at private hospitals is in comparison with the cost at government hospitals, for example? It's a huge gap, to say the least. Let's break it down. According to the report, the latest National Statistical Office survey, 80th round of the National Sample Survey, January to December 2025, highlights India's deepening healthcare affordability crisis. The committee notes that treatment in private hospitals is often 5 to 10 times costlier than in government facilities, with childbirth and serious illnesses like cancer, heart disease, and kidney failure reflecting the sharpest divides. The average cost of inpatient treatment for an illness in India is about 37,858 rupees, while out-of-pocket expenditure is about 34,064 rupees. The average cost of hospitalization is 6,631 rupees in government hospitals as compared to 50,508 rupees in private hospitals. And the gap widens further for serious illnesses like cancer, heart disease, and kidney failure. Not just that, the report also highlighted wide regional disparities. According to it, the average private hospitalization costs exceed 55,000 rupees in Telangana and 52,000 rupees in Tamil Nadu, for example, compared with around 22,000 rupees in Odisha and less than 8,000 rupees in Ladakh. The report also says the committee is of the view that while the public healthcare system remains the crucial backbone for rural and low-income populations with severe infrastructure deficiencies, workforce shortages, and extreme overcrowding, that erodes public trust, driving patients towards unaffordable private care, The committee, however, notes with concern that excessive patient loads in government hospitals directly compromise consultation times and service efficiency. The committee, nevertheless, believes that improving the perceived and actual quality of public healthcare is the most sustainable method to reduce the national burden of out-of-pocket expenditure. The committee recommends an accelerated capacity building initiative focused on expanding bed capacity and recruiting specialized medical personnel in public facilities, particularly in high-demand metropolitan centers. It says the ministry must strictly enforce Indian public health standards to ensure that the availability of essential medicines, diagnostics, and modern amenities in government hospitals matches the responsiveness and patient satisfaction levels currently available exclusively to the private sector. Let's also tell you more about India's medical tourism boom and how the country has emerged as a global healing destination. You see, around the world, rising healthcare costs, long waiting times, and the growing burden of lifestyle diseases are driving patients to seek treatment overseas. And this global shift has led to the emergence of a multi-billion-dollar medical value travel industry. The global medical value travel market was valued at around $115.6 billion in 2022. It is projected to reach around $286.1 billion by 2030. In fact, the market is growing at a compound annual growth rate of about 10.8%. And India has emerged as one of the most significant destinations in this evolving global landscape. Industry estimates place the medical tourism market at around $8.7 billion in 2025, with projections of $16.2 billion by 2030. You see, for centuries, India has been regarded as a sanctuary for those seeking healing, balance, and recovery. And today, this ancient legacy has transformed into a dynamic medical value travel ecosystem. It combines modern medical science with the timeless wisdom of traditional systems. Let's just explain this further to help you better understand what this landscape is all about and its scope. Medical tourism focuses on curative interventions like complex surgeries, organ transplants, and advanced diagnostic care provided by specialized hospitals and healthcare institutions. And wellness tourism centers on preventive and holistic well-being through traditional systems like yoga, Ayurveda, naturopathy, and others. It offers therapies that promote physical, mental, and spiritual health. And together, these two aspects basically form the foundation of India's medical value travel ecosystem. They address both advanced clinical treatment needs and the rising global demand for preventive healthcare. According to the Medical Tourism Index 2020 to 21, India ranks 10th among the top 46 medical tourism destinations globally and 12th among the world's top 20 wellness tourism markets, for example. So that's the potential and the journey that the country has had, with multiple opportunities on the horizon.